I join my colleagues today as a representative of a national sexual and reproductive health organization that works tirelessly to support people's autonomy over their body and their access to vital health care. I want to address an urgent issue that affects us all, the need to regularize undocumented people as a crucial step in supporting gender equality and realizing sexual and reproductive rights in Canada. Last April, an undocumented woman named Perla Estrada was denied an emergency C-section at an Edmonton hospital. She was asked to pay $5,000 up front for the procedure and was told that no doctor would see her until she paid. This is not an isolated incident. Over half of the people Action Canada supports through our Emergency Abortion Fund are undocumented or uninsured. Without donations from the public and the extraordinary efforts of some healthcare providers, these individuals would be turned away from medical procedures that are central to bodily autonomy, to gender equality, and the health of families and communities. The choice over what happens to our bodies and the ability to give birth safely and keep our babies safe should not be a privilege. These are fundamental rights that must be protected and honored. Regularizing undocumented people is part of standing for fairness, for safety, and for equality. Undocumented individuals, particularly women, queer, and trans people, face additional obstacles in protecting their sexual health and rights due to their immigration status. Accessing vital care and services risk exposing them to immigration authorities, making them reluctant to seek help until absolutely necessary. This has severe impacts on their health outcomes, the well-being of their families, and on our communities as a whole. It also places tremendous strain on our healthcare system, a situation that can only be addressed through immigration policies that ensure people can access healthcare when they need it, not when it's too late. Imagine the stress of being close to giving birth and not knowing if you'll be able to get help, or not being able to access prenatal care or an abortion when you need one. Migrants often delay accessing healthcare services due to high fees, which exacerbates their conditions and lead to more complex and costly treatments down the line. We want to live in a country where rights are protected and honored for all, regardless of immigration status. This government has taken a stand and been a champion of women's rights and reproductive rights at a time those are threatened worldwide. Moving forward with regularizing undocumented people is one more crucial step towards achieving true gender equality and ensuring that every person can access the healthcare they need without fear or financial barriers.